and welcome. Today I'm going to show you how to strap your gluteus medius muscle, this muscle that runs over here, with the stretchy, colorful K-tape. Often we find weaknesses in your glute medius muscle after a low back injury, a hip injury, and sometimes just from normal biomechanical disorders. The glute medius muscle is a very important muscle for hip stability, as well as for balancing and stability on one leg. We're just going to use this tape to facilitate the muscle and make it a little bit easier for the muscle to work to improve our stability on one leg and to improve our hip stability. If you're wondering how to apply the taping, please go and look at one of our previous videos which just explains the basics about tape application, simple concepts such as trimming the corners off the edges to help it to stick better, how to clean the skin before you put the taping on, and how to use adhesive sprays that just help the tape to stick a little bit better. To cut the appropriate length of strapping for this technique, you're just going to get the patient into a neutral position like this. Find the bony prominence that we call the greater trochanter. It's where the top of your femur bone attaches to your hip. You're going to measure from that process up until where your lower spine is. You're going to just move about 5 centimeters inwards, and that's the length of the strapping you want to cut. Once you've cut this length, you're going to cut the strapping longitudinally downwards to leave a 5 centimeter base at the end. Make sure you cut all the corners of the strapping off to help it to stick a little bit better. You're then going to tear the base and 2 bits on the side, and you're going to apply the base at that bony prominence. Make sure it sticks properly. To apply the front portion of the tape, you're going to bring the patient's leg back into extension and adduction. And you're going to follow the curve of the muscle right around towards the spine. To do the posterior fibers, you're going to bring them into flexion, adduction, and internal rotation. It's ideal if you can get someone to help you to keep the leg up. Otherwise, if the patient is able to, you ask them to hold in that position while you strap the posterior fibers and cross them at the bottom. Make sure you place both the bases down with no tension. And you can see we've nicely encapsulated the glute medius muscle. This just helps it to work a little bit more efficiently. This video, please don't forget to hit the like button and consider subscribing to our channel. You'll find lots of other strapping videos just like this one for different injuries and conditions. You can see some of the links that I've attached here. Please go and have a look at them. We're going to be continuing this series for another 10 or so videos, and I would love for you to join me.